Urinary elimination. Okay, so basically the urinary system, the whole point of it is to get rid of a lot of waste products that we don't use in our body, and it also helps our body maintain water balance so we don't get either dehydrated or over the top. You actually can die from having too much water in your body. So we should see about 1,500 milliliters, which is around 3 pints of urine in a day from our patients, give or take, right? And but there are some factors that can affect that urine production. As they get older, sometimes they tend to manufacture less, or if they have some sort of disease, we especially look at things like kidney disease. Your kidneys are one of the main organs responsible for urinary elimination and filtration, things like that. So if they had like a kidney disease, then you might see some alterations in their urine production. Another thing is the amount of fluid they take in. Obviously, if you don't take in very many fluids, you're not going to have a big output. But also it depends on what kind of fluids that you take into your body. A lot of you guys, and I do too, are guilty of drinking a lot of sodas. Okay? Sodas do not hydrate you at all. So like when your doctor encourages you to drink fluids and things like that, they're mostly talking about obviously water, but maybe juices, things like that. But soda does not hydrate you whatsoever. So when you're hot and you're out doing stuff and you're drinking Sundrop, it doesn't really help you. It actually helps you get more dehydrated. I know, you gotta love Spirit Week, right? Okay, dietary salt. A lot of our patients who have a lot of swelling in their legs and a lot of problems, we have to decrease their dietary salt. I know, like I feel like I want to dance, right? Yeah. Body temperature and perspiration. Okay, if you sweat a whole lot, obviously you're getting rid of fluids in your body. And then certain medications. There are certain medications that you take that can affect your kidneys and make them not work as well as normal. Now, as far as frequency of urination, how often they go to the bathroom, it depends again on their fluid intakes, their habits of when they're used to going, available toilets, okay? Nurses are some of the worst people about not going to the bathroom when you should. Like, you know, because we're so busy and we're trying to take care of everybody else, then like we never empty our bladders when we should, okay? But it also, again, that kind of ties into that type of activity you're doing, work, things like that, okay? Now, when you have patients, you should always be assessing their elimination needs, and the information of their urinary needs are going to be in their care plan, just like all of their main information. So if we have a normal colored urine, we would expect it to be more of a pale yellow. Sometimes we chart that as straw colored, okay, just kind of that pale yellow, even maybe an amber color, okay, depending on, you know, especially like if your urine has been sitting in your bladder all night long, like when you pee first thing in the morning, it's usually a darker color, right, because it's been sitting there longer, but it may be more of an amber color. Now, we also would expect it to be clear. There should not be any kind of particles or anything that you can see in that urine. And again, it should have a faint odor. Urine does have an odor to it, especially depending on what you eat. Like if you eat a lot of onions and different things, like it's going to affect the odor of your urine and things like that. But again, we would not expect a big foul odor that you can smell from a mile away. Now, when you are assisting your residents with bladder elimination, you do want to look at it. Okay? You want to look at it. What color is it? Are there any particles in it? Or is it just a good clear urine? Is there any weird or super strong odor to that urine? And if they have kidney problems, that may be normal for them to have a little bit of an odor. How much? You're always going to measure that. And again, see if there's any particles in that urine, okay? So you are kind of our nurse's first line of defense. You are so extremely important, and by assessing your resident's urine, that is one of the first things that you can do to alert a nurse that there might be some type of infectious process going on. So this is a very important thing. Now, for people who can't get out of bed or can't get out of bed easily, you're going to use a bedpan, okay? And women use it for voiding, which is just another terminology we use for urinating, and bowel movements. But men mostly use it for bowel movements only. What do the men use for urination? A urinal, right. Now, we also, besides the regular bedpan, we have something that we call a fracture pan, okay? It is a lot smaller, and it doesn't have it's not as raised as a normal bedpan. And if you have someone who has maybe a cast, maybe they're in traction, some type of limited back movement where you can't move them a whole lot, maybe they've had some sort of spinal cord injury, some sort of surgery on their back or spinal cord, a hip fracture, hip replacement, things like that. It's going to be a situation to where, because you guys have already practiced bedpan, and you have to really roll that person over, right, to get them on that bedpan. Well, a fracture pan is for someone who does not have that range of motion for whatever reason, like the reasons we talked about. And again, it's going to be so much smaller that all you have to do is barely lift them up, and you can slide it under there very, very easily, unlike the normal bedpan. So you don't have to use them a whole lot, and I would expect to use them more often in a hospital setting. But again, because people are staying in the hospital for shorter amounts of time, then it's not just absolutely unlikely that you'll use one. So but that would be something you would need to know. Again, men use urinals, but don't forget, if it's at all possible, men need to stand up when they pee, okay? The way a man's body is designed, they can empty their bladder most effectively if they're standing up. And sometimes we don't think about that, especially us as girls, because we don't have to stand up. So we don't think about guys that actually they can't empty their bladder as effectively if they don't stand up. So if it is at all possible, have them stand up when they're using their urinal. Another better situation is at least sitting up on the side of the bed in order to use it. And it's not that they can't lie down in the bed, I'm just telling you what's best. And then but sometimes, especially if maybe they're in a situation to where they can't get out of bed, that's the only option they've got, okay? And they will use that. Now, don't forget that if you do have a patient who cannot hold their own urinal for any reason, you would hold that for them. And there's obviously, if they can hold it, they don't want you to. But I mean, there's just some situations, if you had 2 broken arms, then you're kind of out of luck, right? So people who are unable to walk to the bathroom often use commodes. And sometimes the commodes are wheeled into the bathrooms and placed over the toilet. When they're talking about these commodes, we call them like potty chairs. Not like potty chairs, but kind of, if you guys noticed when we were doing clinicals, some of them had the little portable like bedside commodes, and some of them had it in their room with a bucket in it, but a lot of them just took the bucket off and actually had it sitting over the regular toilet, because mostly it was the residents needed those handles and grips on that bedside commode to get up and down from the toilet, and it's easier for them to sit up at a higher level and be able to get off of the toilet, which is why you see those used in that way too. Now, Also, they keep calling it a commode, we call it a bedside commode. They're beneficial because unlike the bedpans, you get more of a natural sitting position when you're sitting on a bedside commode, and it just is better for the elimination process. It also has a back support, arm supports, things that help the resident stay upright better. And again, we talked about how sometimes they put them in and over a regular toilet to help the person be able to get up easier off of the regular toilet. Now, the container is removed if we use it with a regular toilet. Now, most of the ones I see don't have wheels, but there is a possibility that some of them could have wheels. And if they do, obviously you want to lock those wheels to prevent a fall. Now, urinary incontinence is very common. Of course, when we're talking about incontinence, that means that they cannot control their bladders or their bowels, okay? So, but there are different types of incontinence depending on the particular health of your patient. Sometimes you have stress incontinence, urge incontinence, overflow, functional, reflex, mixed, or transient, okay? Now, your care plan should address this as far as if your patient is incontinent or not. But if your patient is not normally incontinent and all of a sudden they start becoming incontinent, that is something you want to report. Why might that be a change for your patient? What just give me some. UTI, yeah, that's a biggie. A UTI, they may have incontinence as to where normally they don't, okay? Maybe it's a matter of physically they can't function and get up and move as quickly to get to the bathroom as they used to. So maybe it's just a problem of, a physical problem that they have. But no matter what the cause of the problem is, it is something we want to report. It is a change in your patient. Now, if you have a patient that is incontinent, then you want to make sure the number one thing is we want good skin care, okay? Because what is urine made of? Besides water and all, it's made of all these different waste products. There's also a lot of ammonia in urine, and urine is very acidic. So what do you think that does to your skin if it sits on your skin? What does acid do to your skin? It basically causes your skin to break down.